about a minute out.
Does it automatically turn on, or do you have to turn it on?
Oh, it turns on at 10:30.
Is the census guy not coming in?
Bob's calling,
Okay.
I hope. Oh, I gotta dial that in. Thanks for reminding me. We'll hold off for just a second while we get that dialed in.
That's this one? This mic? Is that what you're talking about?
No, I've got to dial in the, hang on. Give me just a second. Hey, Stace, could you send me phone number, meeting information? I don't have it handy. I need to call. Okay, perfect. All right, thanks. All right. I may take care of that while you're speaking, Bill, so.
Oh, sure.
I apologize about last week too.
Oh.
I could probably throw Bob under the bus for that one, but
Don't worry about it.
I'm gonna take it because
We had plenty to talk about. All right. Sorry, we're a minute late here. I've got to make an adjustment audiovisually, but we can get started. Welcome, everyone. I appreciate your attendance today. We've got representatives from our media here. Thank you for coming. With joining us today is Dr. Bill Remington and Commissioner Brad Jackson. We also have a representative from the United States Census Bureau, Deputy Director Alicia Johnson from Chicago, who will be joining us remote. I have to get that set up here in just a second, but I'll get started. Again, the first thing I want to talk about is, I would say it's very COVID related, is the census. Obviously the census has had to take some turns, and we'll hear this morning some of the things that will be going on with the Census Bureau. So Alicia will be joining us, and you'll hear a little bit more about that. What I want to talk a little bit about this morning is the Fairbanks study. The governor initiated that several weeks ago. I think around 4,600 people were randomly tested in the state of Indiana. Dr. Remington has educated us that that's a common method of public health information. It's called surveillance testing. What they found in Indiana was that there's approximately a 2.8% infection rate in the state. And roughly, if you extrapolate that into our county, look at our county population and take that 2.8% infection rate, it suggests that there could be as many as 2,200 people in the county that have had it or currently have it. So I just thought it was important to bring that up, understanding that our numbers of those with symptoms that have been tested positive are, I think, around 60 right now. And this suggests that there's a lot more activity, COVID activity, kind of beneath the surface of that formal testing on those with symptoms. And we knew that all along, but the governor's study is trying to use that information as we move forward. The other interesting things they found out were that roughly 44% of those folks that have had it in that random population were completely asymptomatic, which also kind of underscores the importance of being vigilant with our infection controls, the social distancing and masks and hand washing and so forth. Again, if you look in Kosciuszko County, that would translate to around just under 1,000 people in the county that have it that don't know they have it. The other important item that was picked up was that if you are in a household with someone that has tested positive, there's a 12 times greater risk of infection. And again, that just underscores the importance of social distancing. So this information gives us a baseline for what we thought we knew that we now know from randomized testing and antibody testing, that there's about a 2.8% incidence of the disease in the state right now. And again, just I don't think it's a stretch to extrapolate that to our population. I'm sure there's plus minus there, but somewhere around 2,200 people in the county could have had or do have COVID. So we need to be, for that reason, I think that really underscores the importance of us being vigilant and continuing a lot of these social distancing practices, masks and so forth. There will be a repeat test in June of a new random 5,000 people that will give us great information to know whether or not that disease is progressing from April to June. I think that will be very helpful as we look, especially to phase 4 and 5. What's the rest of the summer going to look like with social gatherings and completely turning things loose. So I think that test, which will be coming up in the next few weeks, will be critical and very important. And again, it gives us a basis for trying to help decide how things are going. Second thing I want to talk about, I just want to let you know the 24th, our playgrounds, pickleball courts, tennis courts will all be opening with restrictions to observe social distancing. And if you can't socially distant on those facilities, wear a mask. Our park office will be reopening with restrictions on June 1st, as are the rest of the city buildings. So kind of a side note I want to talk about, there's just the last few days we've had some flooding issues in the community. We had a big amount of rain on Sunday night, and yesterday, I believe, everything pretty much crested. We delivered about 21 pallets of sandbags out to Sunset Drive. And I talked to superintendent this morning, street superintendent, and there were no requests today. So evidently, it kind of goes along that the gauge I think the gauge went up a half an inch since last night, which is a much slower rate of increase than it had been. So they're assuming that today there will be some leveling off at Pike Lake, and hopefully we won't have to get any further than that. But those areas that typically flood, we're keeping an eye on. Winona Lake also had, I think, their crest yesterday, and it looks like they were down a couple inches overnight from what I'm hearing as well as of this morning. So just a little bit of information. The only other thing I want to talk about before I turn over to Dr. Bill is I just want to mention we had a little hiccup this week in a council meeting where our boxcast went off inadvertently. There hadn't been a community in this state that's been more transparent with access to public meetings than our city. And we've been streaming every one of our public meetings on boxcast flawlessly. It essentially records the meetings, makes them available for future use and access, as well as live streaming. Our investment in professional audio and video has just made this really tailored for the current conditions, and being able to provide that access to our community for these meetings that the Public Access Counselor has allowed to go virtual. So, but that hiccup was at a very inopportune time the other night, and we will certainly renew a little bit of public discussion about that item, which was the incentives for an extremity out at the Tech Park. We've already taken our vote, we've already deliberated, and we don't want it to appear as a rehearsed meeting, but I think it's important that since those comments were not heard in their entirety, I think we'll probably have some discussion at one of our next meetings coming up. I would also remind you that decision that was made by the council was voted on in front of the press, and it was just a memorandum of understanding. The actual agreements themselves will have to come before the board again later in the year when the timeline requires. So those all those public votes will be back at our public meetings, and hopefully by then we'll be open, and those meetings will be open to the public. Just to clarify what the public access counselor said, that in the governor's executive order, we have to make those meetings available to members of the public and the media. And, the effort to do it virtually, we feel has always been our strength, but we had a once in a couple year hiccup the other day that we do, we can't apologize for. We didn't have anything to do with it, but we're certainly looking into it to make sure it doesn't happen again. So with that being said, I'm going to turn it over to Dr. Remington to talk a little bit about our current status and maybe a little bit more on the Fairbanks study.
Sure. Thanks, Mayor. Just in perspective, it was 4 months ago on this date that the first U.S. confirmed COVID-19 case was announced. Almost 2 months ago, we had our first Kosciuszko County case. Now there are 1.5 million U.S. confirmed cases, about 29,000 in Indiana.
Please enter your access code followed by the pound or hash
And we have
sign.
62 confirmed cases in the county. And as the mayor just related from the...
You entered no digit. Please
from the
re-enter your
prevalence
access
study,
code followed by the pound or hash sign.
there have been a lot more cases than what are confirmed, and we have felt that all along. So this virus has obviously shown efficiency in transmission through the population, undoubtedly, as we know now, including lots of people with no symptoms shedding the virus. And we have been fortunate in this county. So even though we underrepresent the cases with our official count of 62, our hospitalization pressure from this county has been low. As we have had reported to us, 9 hospitalizations during this whole pandemic, including involving Kosciuszko County residents. 10 of those 62 official cases recently tested here in the last couple weeks, where there has been quite a bit more testing, including people with no symptoms, and unfortunately 1 death. In the last 2 weeks, our case count has gone up quite a bit, 23 more cases. But in that last 2 weeks, we've done 430 tests that we know of, and probably more that have just not been reported to us. So our percent positivity remains low. It's hovered right around 5% for weeks. Looking at CDC data this morning, the percent positivity across the country has been around 10%. And in this region, Region 5, several states, it's about just shy of 11%. So Kosciuszko County, as imperfect as testing has been, has had a relatively low, very low percent positive. So we've been fortunate. The prevalence information will be increasingly important as elected officials engage with the public health community in knowing the right way to open up the economy, open up their jurisdictions. We also need to follow the syndromic surveillance information, and Regenstrief in Indianapolis is a wonderful resource for all of us. It's quite a think tank. Their data can now be found on the COVID-19 dashboard for the state of Indiana. You have to click on additional resources, and it'll open up more charts and graphs than you care to probably look at. It's very sophisticated, looking at things like pressure in the emergency rooms and ICUs, death rates of hospitalized patients with COVID, that kind of thing. We've been fortunate. Those trend lines, both nationally and by the state, are trending downward. And that's a good thing. So both from percent positivity of tests, and these syndromic surveillance pieces that are so important, I think, to watch, independent of testing, it's good. I'd say soldier on with the opening up motif that I think the state of Indiana is doing just right. It should be incremental. We want to look at the public health data as we go. We will see more cases. That prevalence information is going to be eye-opening, I'm sure, as it comes to us in the weeks ahead. We need to continue to protect particularly vulnerable subpopulations, and I think mostly of our nursing home residents. And I want to just give a shout out to our local nursing homes who have done a heroic job in this county. I just had conversation this morning with Teresa Reed, our communicable disease nurse at the health department, and she was so very appreciative of the approaches our nursing homes have taken. There have been a case now and then, but we've had no wildfire within any given institution. And it's to their credit. They've implemented policies that are stringent. There's increasing use of surveillance testing in these high-risk settings, and that's all good. So I want to give a positive report again this week, despite a growth in positive confirmed cases. It still has a guarded edge to it, because I still a bit respect the vulnerability of particularly the nursing homes and others. But I think we should continue to move along and open up the economy, which is a very, very substantial piece at this point in the pandemic. Thanks.
All right. Next, Brad Jackson, Kosciuszko County Commissioner. How are you, Brad?
Good.
Good.
Thank you for having me here today, Mayor.
All right.
So basically, the county had reopened this past Monday, so we're into day 3. In conversations I've had so far, it sounds like things are going well. I think we're being pretty vigilant on things. We have a chemical called vital oxide that we're spraying daily, and we're also hitting all the touchable surfaces on a daily basis. We've installed social distancing, like the crowd control things you see at a movie theater or something that herd you through lines. So we've installed that to promote social distancing. We've also have signs up encouraging that. We've also made different entrances to be only an entrance and other ones to be only an exit, so that there's less passing of people in the hallway, more of a flow through. We also have thermometers and masks available to people as well. We're not insisting that people wear masks, but we're encouraging it with some signage at the doors. We've also installed the, for lack of a better word, the sneeze guards, the plexiglass you're seeing every place in various offices. And like I said before, most of it, our officers are so different as far as how they're set up. We let each department head make the decisions on, you know, some of them we actually have a table set up so the public can't get into the office. They do all their business in the hallway. Other ones that have a big area inside, they're allowing them in, and that's where they have the sneeze guards and things like that.
Please enter your access.
So far so good, and I'm glad to see that we're moving forward. I agree with Dr. Remington. We need to get this economy going, because there is definitely damage as far as even life that's being caused by being shut down. So I think it's good that we safely move forward. And I hope too in the future, some of the reasonable precautions like the sneeze guards, not shaking hands, things like that, they're, you know, just good prevention as far as disease spread will continue, so that the flu and colds and other things like that will be minimized in the future. Not the masks though. I think those be good when those are gone. So.
All right. Thanks, Brad. We'll get back for questions here. Been struggling a little bit. I think we have our representative from the United States Census Bureau. Alicia, are you there?
Yes, I'm here. Thank you so much.
Oh, good. Thank you. Let me turn you up a little bit here. Alicia, there's
Okay.
3 of us here, and we've got 3 members of the press who may have some questions. We've talked a little bit about how important the census was before all this came up, and how you all have had to really pivot in the face of such changing circumstances. So thank you for joining us. And I'd love to have you spend some time talking about what we need to do here in our community to ensure that that census is complete as possible.
Well, thank you so much for having us join the call this morning. I'm hoping that you can hear me okay. So on behalf of our regional director, Marilyn Sanders, again, we appreciate the opportunity to join you this morning on our updates for the 2020 census. Yes, it has been a challenge for us, but we really, really appreciate you, Mayor, and your commitment and hard work towards ensuring a complete count in your area, and of course for providing this platform to engage and educate your community to continue to participate in the census. The Census Bureau, of course, we've been working for more than a decade on the 2020 census to make sure that we count everyone once and only once and in the right place. That's extremely important for us, particularly in this environment. And with the current situation, of course, impacting the entire country and across the world, the Census Bureau, we want to continue to monitor our operations based on the guidance from the CDC, our health authorities, and to ensure that not only the public is safe during this time, but to make sure that our staff is working in the most safe environment that we can provide for them. So one thing I want everyone to keep in mind that the 2020 census is by far for 2020 is the easiest, and we have some of the easiest ways for the public to respond, of course. And we're really encouraging people in this environment we're pushing traffic to our toll-free number to self-respond, and that number is 844-330-2020. And we're also pushing the public to visit us on our website at 2020census.gov. Or if you receive that census form by mail, to make sure that you fill it out and mail it back. So this is a very easy and safe way for us to make sure that we're responding to the census. We don't want the census to get lost in all the voices in terms of what's happening to our country. We want to make sure that we keep the census message loud and in front of the public because it truly impacts so much that we do. Over $675 billion at stake for our communities in terms of federal dollars that are at stake. And so we want to make sure that the public is aware of all those programs that will be impacted by the 2020 census. And so again, while we're practicing social distancing, we want to make sure that the public is keenly aware of how they can respond. So, and we have a special message right now for college students who are home during this time, during the COVID-19 outbreak. College students who usually reside at school should be counted at school. So we've been working really hard to educate parents so that parents will understand that while the students may have come home a little bit early in terms of the school timeline, those students should be counted at school. And so we want parents to know that the colleges and universities we are currently working with our group quarters facilities, which includes the colleges and universities, to make sure they are providing us with their census enumeration counts to include those students who would have originally been on campus. And so, and we know that there may be an opportunity, or we may see some households that may be counting their college students at home. But the Census Bureau, we have very, very strong quality check processes, including our post-enumeration surveys, where we capture any type of duplications where college students may be counted at home and they may be counted at school. But we want to encourage those households that have college students at home right now that have not responded. We want to make sure that they understand that that those students should be counted at school. So where are we right now? So this week, the Census Bureau, in coordination, of course, with federal and state and local health officials, we began to drop off 2020 census questionnaire packets at the front doors of over 39,000 households in the state of Indiana. So we got geared up last week, and we start notifying our partners across the great state of Indiana to let our partners know, so that if they fall into what we call the update leave area of Indiana, that our staff will begin dropping off census forms in those areas. In the update leave areas, those are areas where we don't necessarily see traditional mail services, where we have identified early on in the census process where we may have lower internet connectivity in some of the rural areas. And so we actually started the update leave area in Indiana today. Preparation began last week. And again, keeping the safety, the health and safety of our employees, of course, is in the forefront of everything that we do. And so in your particular area, Mayor, we have dropped off forms to more than 2,000 households. And so we will be dropping off forms at more than 2,000 households beginning this week. So that's critical. So we want the public to know that when those forms are delivered, and it's just a drop-off at the door, again, with safety being in the forefront of everything that we're doing, we want to make sure that residents understand that our staff is out there disseminating those forms, making sure that we are crisscrossing across the state of Indiana to make sure that in those update leave areas that those forms are being delivered. So in response to the pandemic, we have significantly adjusted our operational timeline, including the update leave operation. The public can now actually self-respond up to October 31st. That's an extension of our timeline, which originally was at the end of July. And so now we're going all the way through the end of October to ensure that our residents are counted. Census enumerators are now scheduled to visit households that have not responded. And so we're getting geared up for that operation, which is called the non-response follow-up. That operation was originally due to start in May. Forgive me. That operation was due to start in May, and that operation non-response follow-up has now been pushed to August the 11th to October 31st. So we've made some adjustments, and we want to make sure that that the residents across the great state of Indiana are aware of these adjustments. You know, as I mentioned, from the college campuses to the actual self-respond process in terms of people going online and by mail, all those timelines have been extended. So in terms of how the nation is actually responding, all across America, and of course including the state of Indiana, people are really, really stepping up and responding from home. And we want to continue to encourage residents to continue to respond. So as of today, the national response rate is at 59.6%. That's pretty significant considering where we are right now in terms of combating COVID-19. In Indiana, I'm so happy to announce that the average response rate in Indiana is at 64.6%, and in Warsaw, the self-respond rate is at 62.9%. So that's really fantastic that your community is above the national average. We're hoping that now that update leave is in full effect this week, that we will continue to see a growth in your community. And I just want to just wrap up by saying that we are very thankful for the outreach that's taking place. We recognize that we cannot do this without strong partners. And Mayor, I tell you, we are very fortunate to have you and your team working in the area to make sure that that the residents there are counted. And again, we are taking every precaution that we possibly can to make sure that our staff is working in a safe and healthy environment. And so I just want to encourage those who are listening I just want to just reiterate that the census is safe, it's easy, and it's important, and it impacts so many things that we do. And so people can respond now, again, by going on our website at 2020census.gov, or when they receive that form that's being dropped off, to make sure that they fill it out and mail it back. And so thank you so much again, Mayor, for allowing me to speak this morning on behalf of the Chicago Regional Census Bureau.
Well, thank you so much. I'm glad we finally made our connection, and you were heard loud and clear. We're thankful that Indiana and our community, Warsaw community, is doing their part. However, we want a complete count, and we know we still have a little ways to go. We've just lengthened the race a little bit, and I think extending that deadline certainly will help. Questions I have for you, just to clarify. So you'll be dropping off around 2,000 packets at the doorsteps of our local community. I think you said this week, is that correct?
Yes, yes,
Okay.
starting this week. So yes, starting this week. We began preparation and training for the staff last week. So Warsaw is due to for those forms to start going out this week.
Okay, and they can utilize those packets and fill out a paper form that they mail in, but they could also jump online and do it as well, correct?
They absolutely can. They absolutely can. So, you know, when people go online to self-respond online, and it sounds like your residents have been responding via the internet quite well to date. So, yes, you just go online. It's really easy. It takes totally less than 10 minutes to fill it out. The questions are easy. So, yes, residents can still go online to self-respond.
Good, and that's 2020census.gov, correct?
Yes, yes.
Great.
Yes, or they can do it by phone. Again, and that number is, the toll-free number is 844-330-2020.
844-330-2020.
Yes.
Great. Okay. One final question then. The last phase of the census has been extended through October, and that's the non-response follow-up, and that's where a census worker will actually come to the door. You say that's been pushed back to August, from August 11th, I think,
Right.
through October 31st.
Yes.
Okay?
Correct.
And at that point, if someone is notified that way at their doorstep, will they actually take the census, fill the census out form there while the census form is working there, or will they just be handed a form to mail in?
So right now, because things are still, you know, quite fluid with, you know, COVID-19, right now that operation is still set to go. So the original date was May the 13th through July 31st. Right now, as you mentioned, it's now been pushed to August 11th through October the 31st. And so we are still reviewing any guidelines that are set forth by CDC, and of course, state and local health guidelines as well. So originally, during the non-response follow-up period, the staff would go out. They could have up to 6 touch points with the household, and that could be, you know, of course, a knock on the door, even a postcard, a phone call, to encourage households to respond to the census form. So if a resident would request assistance with the census form, of course, the staff is there to provide any question, any type of question, would encourage people to go to call our toll-free number with any questions. And so the staff is available when they make those knocks on the door to provide any assistance that a household may have. So I'm kind of couching that because of the environment that we're in.
Sure.
And so it will, you know, so we're kind of waiting to see if the same provisions that we would have used during the original timeline, if those particular guidelines and provisions will still be in place, depending on where we are in tackling the situation that we're currently in, and what type of guidelines in terms of health and safety our staff will have to follow during that time period.
Okay.
So I just want to make sure that, we're aware that things can look a little bit different in terms of, what type of interaction our staff may have with the household.
Sure. Well, I think extending the deadlines is critical, and I appreciate you spending some time with us and updating our local community on how you all have responded and how we're doing and what we have left to do. So that's all great. Listen, to respect your time, I've got a few members from the press that might have a question, and I'm just going to open it up to them right now so we don't have to wait for the rest of the press conference to do that. Would you be willing to take a few questions?
Sure.
All right. Yeah, I'm just going to point to the microphone. Go ahead. All right. So this is Dan Spalding from Ink Free News.
Hello. First off, could you spell your name and your title again, please?
So it's ELLISA, last name is Johnson, JOHNSON, and I'm the Deputy Regional Director for the Chicago Regional Census Bureau.
Okay, thank you. And one question, you mentioned the phone number first. Is that your preference? And I'm curious to know if you can do it by mail, online, and by phone. How does that shake out in terms of popularity?
Well, right now, we're encouraging. This is 2020 is quite different from any previous decennials. In past decennials, we only had the paper form in terms of how people could respond. So 2020 has allowed us to have different ways that the public can respond, and that's via the phone, the internet, or paper. And so it's fast, it's easy. Right now, we have been tracking the self-response rate in terms of how people are responding online. The public seems to be trending very high in terms of individuals responding online. And so I can't say that there's a more favored way in terms of what may be a little bit easier for people. It is easy for you to pick up your cell phone. You can go online and self-respond. That may be a little bit quicker, easy for people. We know that we're in an environment where we have a millennial population that likes things fast and easy. So for that particular group, picking up a cell phone and responding online may be a better way for them to do it. In some of our focus group studies, we did a focus group in Providence, Rhode Island. We did our test run in Providence, Rhode Island. Showed us that the senior population tends to favor paper a little bit more. So I think it just, one of the things that we're most proud of is the fact that we now have 3 ways that people can respond. So, the website is available, the toll-free number is available, and of course, as mentioned earlier, we are dropping off those forms at over 2,000 households in the area.
All right. A couple more. This is Nick Duranick from the 1480 News Now.
Hi, Mr. Johnson. If you have the data available, or you can kind of take a guess, how has the response to the census so far this year compared to the one 10 years ago?
You know what? I don't have that data in front of me. I know that we're trending pretty well, especially in light of some of the challenges that we've had in terms of our timeline. I don't have that in front of me. I apologize, but I can certainly have the media team route that information back to you.
All right.
The national average, as I mentioned, is at right around 59%. We do have a great mapping tool on our website that has those types of trends that are available. So I can certainly have our media team to get back with you so that we can share that out and you can see how the country is trending and how we looked in 2010. But we've been pretty satisfied with how our states are doing. In our 8-state region, we've got great partnerships on the ground. We are working in some of those low responding tracks. We're tracking those tracks up against how we did in 2010 as well. So we have a very robust plan in terms of how we stay ahead of 2010. So again, I'd be more than happy to, you can email me your information and I can make sure that our media team routes that information back to you. I may have a media person on the line with me, I'm not sure, but I can certainly get that information back to you.
Yeah, and you could certainly send it back through my office, and I'd be glad to get that out as well. This is the mayor, so
Okay.
thank you.
Got it. Okay, thank you, Mayor. We'll make sure we do that.
Great. I think we've got one more question. This is David Sloan from the Warsaw Times-Union.
Good morning. A big concern, especially among older people, is being scammed. What can people do to make sure they're actually filling out correct census forms, talking to the correct census people later in the year? How can people prevent being scammed?
Well, our teams are we track those, different types of scams that we're starting to see. We also have, for the media, we also have a page on our census site called the Rumors page. I would encourage you to take a look at that page on our website. We try to make sure that we're keeping up with that. We also, through our headquarters, we try to stay in touch with law enforcement. Anytime we hear of any type of new activities that may be occurring on the ground, we want to make sure that we have that type of relationship, of course, with the mayor, that we can pick up the phone and we can call the mayor can call us if there's anything new that's kind of surfacing. Our teams try to stay in close communication with our folk at headquarters to make sure that if we're seeing any new activity, that those things are being reported to us. But we do have a very active page on our website at 2020census.gov called our Rumors page. And we really try to track those things to make sure that if there's any new rumors, anything new that's surfacing, that the media is aware of those things as well. And so those partnerships that we have on the ground, like anytime law enforcement, if there's something surfacing, if there's someone impersonating a census employee, we're very clear that our employees they have very clear identification markers. The bags that they carry, the badges that they carry are all very clear census identifiers. But we know that there's a lot of creative things happening in terms of scams across the country. And so, again, that's the reason why we try to work very closely with law enforcement so that we have that type of line of communications to kind of curtail anything that's happening in the field. So our partnerships with the mayors become extremely important because we have mayors that will call us and say, hey, do you have someone working on this particular block? If there's, we have more than the 2020 census happening with the Census Bureau. At any given time, we can have a number of surveys where we have staff that's working. But right now, we have very limited staff in the field. And so we want to make sure that we have that line of communication with law enforcement and with our local mayors and our community organizations who have done a wonderful job of tracking any type of activities where seniors may be a little uncomfortable. And surprisingly, I'm averaging about 2 calls myself per month from different mayors or congressional members where seniors have called in and said, is this a legitimate census form? And how can I find out if this is a legitimate form? So it comes to those really close working relationships that we have with our partners as well as law enforcement. So, but I really encourage you all to look at that Rumors page on the census website. So we try to keep that updated as often as we can.
Well, thank you, Alicia. I appreciate your time this morning. I think your information has been certainly comprehensive, and I appreciate you taking some time to answer a few questions. You're willing to sit around and listen to the rest of our press conference if you'd like, but I know you're busy, and if you jump off, that won't offend us at all. But again, thank you.
Okay,
Certainly
well-
appreciate your time.
Oh, thank you so much, Mayor. And any questions, just we'll make sure that, we get that data back to you in terms of what was asked. And anything you need, just please let us know. And I truly, truly appreciate you allowing me to be here this morning. So take care and be well on behalf of our regional director.
All right, thank you so much.
Thank you. Thank you.
All righty. Okay, so we got a little time for questions here. I'd say jump to the mic if you got a question. Don't touch it.
All right, gentlemen, so stage 3 is supposed to start on Sunday. Just based on what you've been hearing, what you've been reading about, what you've been seeing, and I'll take it from a health perspective and local government's perspective, are you comfortable with that possibly happening just based on what Governor Holcomb talks about today or Friday?
I am. I think the metrics that we discussed a few minutes ago apply, and I would have great comfort moving on to the next stage.
And again, now using that guidance, I feel, as I have through the beginning of this thing, utilizing public health guidance to move ahead is critical. And with additional tools that the state is providing us, and we have contact tracing, increased testing, and now this surveillance testing, I feel very comfortable that we know where we're going to be. And the great news to me is that the governor has given every community the ability to clamp down if they feel the need to, if they feel like they need to keep restrictions in place or make them even greater. Local governments have that ability, but at this point, moving from stage 2 to stage 3, I don't believe we need to do anything any different other than continue to, enact these restrictions of keeping our masks on when we're out in public, washing our hands, and maintaining social distancing. Brad?
I agree. It's ready to keep things moving along. And I think, when you're out and about, you see that people get it. I mean, it's kind of interesting. You walk by somebody in the store, they'll step back into an aisle to let you around and stuff. I mean, I think the point's been taken by the public, and I think it's time to move on, but do it safely. And I think that's what's happening.
Okay.
I have a question for Dr. Emerson. I've probably been reading way too much, but, there's the whole thing affecting children now, that multi-symptom thing. Dr. Bachfish with me and now one case. This morning I'm reading that a northern part of China, there's a more severe strain of COVID that lasts longer than people. I mean, everything seems to be going well, but then I keep reading this other stuff that maybe puts it kind of on there's other things out there to be weary of, I guess.
So, welcome to the world of infectious disease and public health. There are many evils out there. Why we don't all come down with them in a big way every year is amazing, really. So stay tuned. I don't diminish this particular pathogen, obviously. This has been a substantial pathogen. I do feel the worst is in the rearview mirror. Whether there will be a surge later, nobody perfectly can predict. My hunch, my personal hunch, is that this emerging prevalence understanding, such as what Fairbanks is doing in Indiana, will open our eyes that, as you would suspect, from 200 countries within months having this, that this has been a pervasive, prevalent pathogen, and that most people, fortunately, do not have a disastrous clinical outcome. Some will. More chapters to be written in this textbook. So, great question.
Brett Jackson, I don't mean to put you on the spot, but Warsaw is committed to the KEDCO Fund, the state is committed to the KEDCO Fund. Last night, Winona Lake threw in $30,000. Do you believe the county should contribute to the KEDCO Small Business Relief Fund?
I don't think it's been decided that they're not. They just wanted to table it and discuss it some more. But as long as, and I think one of the things that happened at the meeting was, the understanding originally was that the money would be put in by the county, and then it would be paid back to the county. And I think somehow, and I think it was a little bit of miscommunication, that the money would stay with KEDCO, and I'm not sure your understanding of that, but that was part of it. So I think they just want more discussion. I don't think there was a definite, as I've talked to council members since then, I don't think there was a hard no. I think there was, let us think about it. Excuse me. The other thing I think as well is they're waiting on the decision for that, I guess. I got distracted, sorry.
Are you hearing from businesses saying we need
I have
this?
not heard from, I know, sorry, I had notes I was using and something came on there and distracted me. The county is gonna, I think, wanting to also wait and see if it's needed. In other words, if the requests and demands aren't there, they don't want to have the money just sitting there and make that transfer for nothing. So I think that was the other part that I'd heard that they were waiting on, is to see, kind of a wait and see if it's needed. Because if it's not needed, then there's no point in putting it in and taking it back out. That seems like an exercise in futility.
Yeah, and I'd support Brad's answer. We kind of went through a lot of those same discussion points, and I know that it's very straightforward in our agreement that the funds will be paid back when they're received within 30 days of receipt of any funds. They will come back. It's not a revolving fund. Our fund is strictly for the use of those individuals, or those businesses, excuse me, that need it, and it is not a revolving fund. Those funds will come back and go back into our edit fund.
And
So,
I think that, I wasn't at that meeting, but I think that was the misunderstanding and kind of what
Yeah.
the train left the tracks that night. Not the tracks necessarily, but where they just wanted to pause and get more information, because that's a lot of money. They really take seriously spending tax dollars, and they just want to get more information before they make a decision.
we went, like I said, we went through those same discussions, and I think it's important that it's laid out up front what the expectation is. So I certainly support that the county needs a little bit more time to make that decision.
I want to ask a follow-up question to what Dana asked last week about restaurants. He asked if you had heard anything. Since then, I was in a restaurant which was probably mostly Spanish-speaking. None of them were wearing masks at all. I still ate there. So I guess my question is, what have we done for the Spanish-speaking community? Like people who work at restaurants, are they being, is anyone reaching out directly to them and saying, hey, this is what you need to do, or?
I certainly know that they fall under the guidelines of the state, and I know that a lot of government communications are in different languages. We haven't sent out anything to any restaurants as far as locally. I don't believe the county has either, or any businesses for that fact. We're relying on what the governor's executive orders and his coming back plan have stated. And I'm almost certain that those are available in Spanish. But I know that we don't, I was just answering questions this morning about the downtown and the different businesses in the downtown and what our role is and what our plans are. And, we're basically following what the governor says. I think, though, at least for the next phase, into phase 3, as we already answered, I think we feel comfortable moving to that next phase. As we get to 4 and then potentially into 5, we've gotten more tools that are becoming available. So those openings are a little bit more tentative. I think I'm more concerned about social gatherings of large numbers in the face of some of this surveillance data that we're getting. So to answer your question, I feel like that the local Hispanic population and others that have different language needs, those are provided by the state, and that's where those directives are coming from.
Dr. Remington, I had a question come in from a listener earlier this morning. Yesterday, Nicole sent out data that broke down the cases again by age, with the highest, I think, was in the 40s range. This person wanted to know, were you surprised that the age levels with the most amount of cases have been lower than to where they first might have been expected to be higher with those above like the age of 60 or 70?
I have noticed that. I think it speaks to who goes and seeks a test, really. And just as a physician in the trenches in primary care, I will see more midlife and younger patients seeking a test than I will elderly people seeking a test. Just in, I don't know. I think there is a fearfulness of going out if you don't have to. And whether or not it reflects that there has been decreased prevalence among that particular age group, I do not know. We'll need to look at that as prevalence data comes forward. So I see it as mostly a health-seeking behavior issue.
So Nick, that was from the local data as far as the number of confirmed cases? Yeah.
County.
County. And I'm curious, I haven't looked at the prevalence data in the Fairbanks study, but I think you could probably get pretty good information from that as well as far as age breakdown. I know that they did confirm that certain minority groups are more susceptible just based on that surveillance testing, that data. And I know they have the numbers on age as well. So that's probably going to give, I would consider, a more valid sample, if you will, of symptomatic and asymptomatic patients. All right. Well, a lot of information today. I think the census is a big issue that I don't, they plan for 10 years and all of a sudden they get the curveball at the last minute. Speaking of curveball, Dr. Remington, why don't I just ask the question so Dan doesn't have to?
So here, the initial epidemic curve that had been forwarded to our health department from downstate was a 12-week rolling hill. It's a very simplistic model, granted. And it started about a week or two before our first confirmed case in their estimation. And it tails off in mid-June. And we're kind of fit. If you look independent of the growth of positive cases, which reflects just tremendous increase of testing, I really feel we're fitting that epi curve. And I think we'll see over the next month much less clinical grief, not that we've had much to begin with. So I'd say we're in the last few innings, last eighth inning. I guess I said eighth last week too. I'm going to linger here for a while.
That's how baseball is, it's long sometimes.
It's one of those innings, right?
Do you worry that, just like a ball game, if it's 7-3 in the eighth, fans
Yeah.
start leaving, fans feel too comfortable?
That's a great, we're really playing that metaphor, and it could be, Mr. Spalding, it could be. We need to just really make sure the statisticians remain in the game here. Help us out. Okay.
That's right. Mm-hmm. All right. So we'll be back next Wednesday. I think Dr. Hoffert's going to be with us, talk a little bit about schools next Wednesday. So we continue to bring, hopefully, the public information that's important in a forum where questions can be asked. And I would advise anyone listening, if they have questions, they can certainly submit them to our office or any of the media representatives here. We're certainly happy to take any questions. And again, we'll see you next Wednesday at 10:30. And Dr. Remington and Brad, thank you very much.
Thank you.
All right.
Commissioner Conley, next meeting is the plan.
Okay.
There you go.
All right, thank you.
Thank you, gentlemen.
Thank you.